In the STRRIDE study, William Kraus tried to understand the relationship between the intensity of exercise and insulin sensitivity. Some 260 sedentary subjects from 40 to 65 years of age with a BMI between 25 and 35 were randomized into 4 different exercise groups: inactive, low-dose moderate, low-dose vigorous, high-dose vigorous.
We observed 3 things. Number 1, that moderate intensity exercise appeared to be as good as or better than vigorous intensity exercise and insulin sensitivity. Second, that there were unanticipated effects on beta cell function by exercise. And number 3, that in fact exercise effects can persist even up to 2 weeks after cessation of exercise. I think physicians should be conscious of the fact that even modest exercise at a modest level, like brisk walking, can have very beneficial effects for their patients, and that they should recommend approximately 30 minutes a day of brisk walking most days of the week.
A moderate level of activity seems to be beneficial, but is there a difference between long-term and short-term physical activity in terms of cardiovascular disease mortality? Susan Shortreed tried to answer this question by reviewing the physical activity data of some 5,206 individuals who were followed by the famous Framingham Heart Study.
Well, the results generally show in the Framingham Heart Study population that being always active or active your whole adult life does have a decreased risk in cardiovascular disease mortality, about 35%. And then if you only look at current physical activity, it's a reduction of about 27%. So it is a greater reduction, but it's not a huge reduction. And so we perhaps show that being always active is just as effective as your current physical activity. And that is perhaps what's driving the activity history. Basically, it's never too late to start, and that doing something now is better than being inactive forever. Starting now is going to decrease your risk.
Thanh-Huyen Vu looked at the lifestyle practices of patients aged 65 years and older with a 7-year mortality follow-up. She reached the same conclusion.
When you start your healthy lifestyle practices since you're very young, you are far better. But even when you are older, that's not too late. So go ahead, please, practice.
So we just heard a combination of results from epidemiological studies and intervention studies regarding physical activity, exercise, and cardiometabolic risk profile. Nick, we heard from the STRRIDE study that low-intensity exercise is actually, when you look at that one marker like insulin sensitivity, as good as high-intensity exercise.
I think that really fits in with what we think from the literature, which is that probably the most important thing in determining diabetes risk is the totality of energy expenditure that people use in their everyday lives. And that study was very interesting, and it sort of seemed to suggest that it didn't really matter whether you spent that energy doing vigorous things or just usual activities at a low level. And maybe that's really important for the public, because for some people, doing vigorous activity is what they want to do, and that's fine. But for other people, it isn't, and they find it hard to fit in with their everyday lives. And if we can tell people that there are benefits to just increasing the energy expenditure, doing low-level intensity activities, fitting them around your profile of how you live your life, that's a very, very positive message.
And the other thing, it brings also the issue that on top of exercising, if you want to vigorously exercise, make sure that the rest of the day also you don't compensate by becoming a sedentary person, because you'll have a minimal impact on your total daily energy expenditure.
Well, it could even go the other way, that there's a suggestion of substitution, that if people do vigorous activity, they're so tired by that, they go home and sit on the couch and watch TV, and there may be counterbalancing in the wrong direction, that vigorous activity. So probably the more important message is we all need to increase our overall energy expenditure, by however we can do that. And there are systems in society that are mitigating against that, are driving in the wrong direction. I mean, this film was very illuminating, because behind the pictures of people talking about the benefits of activity was an escalator, and nobody was walking up the stairs. Everyone was going on the travelator. As we have to find it easy for people to make choices. If you put at the bottom of a staircase, if you put a decision point of decision choice. If you say, using this staircase will potentially prolong your life, I mean, that's a very positive message for somebody. Use the stairs rather than taking the lift, and it's a very positive message.
So therefore, in addition to attending scientific conferences, we need to think about reshaping the way those scientific conference centers are built.